Doctor, I am so tired. I can barely function some days. And I also can't sleep. So I go to bed at night absolutely tired. I can barely fall asleep. And when I do, I wake up in the middle of the night and then I can't get back to sleep. And so then I just lay there in this like in between state of awake and asleep. And when my alarm finally goes off, I crawl out of bed and then I try to start the day. I can barely function. I have headaches that sometimes last 2 or 3 days at a time. I have indigestion that seems to get me every single meal lately. And I can't really perform at work anymore. So I'm taking a break from work. I'm in between jobs actually. But I have been hired and I will be starting in a few weeks. And I'm doing all this training. But now when I'm doing the training, I can't actually remember what I'm trying to learn. And I feel like I'm way too young to be falling apart and don't know what to do. Can you help me? So, this is kind of a common clinical scenario that I might run into. Okay. And so, one question that I would ask then is, hey, well, when did this start? And so then the person might be like, well, I kind of always have had sleep issues. And, I've never really been great about getting up in the morning without a bunch of coffee. And, I used to just, wake up kind of tired, have a little bit of a sleep issue, but was no big deal. Kind of always had that sleep issue since I was a kid. And then I wake up and I have coffee and I get going. And then in the afternoon, I might dip a little bit, but then I would have another cup of coffee, or I might exercise or maybe have a snack. And that seemed to work for me. Um, but I had this dream job that I got about 5 years ago. And everything was just awesome. Everything was great in my life at that time. And I took this dream job, and the dream job turned out to be kind of a nightmare. And so I was working with somebody, my immediate superior had some issues, so to speak. And as a result, um, everybody was walking around on eggshells all the time. And some of the things that were agreed on in the contract were not actually happening. And promises were being made to our clientele and they weren't happening. And so basically, our uh, business was constantly in crisis mode. And at that time, I began to have more severe insomnia. I began to have migraine headaches. I began to have joint pain, and my morning fatigue didn't seem to wear off, even if I had coffee. And then my afternoon fatigue didn't wear off either. So I was basically just tired all the time, and my sleep got worse. And then now headaches were added to the mix. And this all started during that job. That would be one scenario. Another scenario might be, well, I separated from my spouse. Um, the last 2 years of that marriage were extremely stressful. Um, the separation was extremely stressful. I'm currently involved in litigation, and we are very contentious and acrimonious at the moment, trying to sort all this out. And since this started, um, I basically can't sleep at night. I can't function during the day, etc. Another scenario might be, um, well, I got COVID. I think it was COVID. We don't know for sure. We didn't do the testing because it was like November of 2019. And so it was just really severe, like upper respiratory issue, and just really never came back from that. Just haven't been the same ever since. So this is a super common clinical scenario that I see. And it's a person that has a particularly severe issue or chronic issue. And it seemed to have started at a moment in their life when there was peak stress. So my goal today is to talk a little bit about the short-term consequences of that situation and why some people, more importantly, why do they bounce back from events like that, and then other people seem not to bounce back and seem to lose function and don't gain it back, and then end up going into different versions of standard medicine and then alternative medicine, and just kind of end up on this carousel of different practitioners trying to get their life back. And so my goal today is to have a conversation, or a one-sided conversation about really the underlying physiology about what's happening in these cases at a core level, and to show a couple of examples how in a clinical scenario I screen for these things with forms and what these things look like in labs, and then to give a sense of what you could do to help you with resiliency if you've had a crisis and maybe haven't come out of it, but then also just to kind of advocate for you at this moment. You really can't prove prevention, and that's a really awesome idea, though, is to like prevent things before they happen. And but a person can absolutely take steps and evaluate where they are and sidestep some of these major things. So the conversation today is really going to be focused around inflammation and this concept of a self-amplifying permanent plastic loop. Okay, so what I'm trying to say is, in all these different scenarios, what ends up happening is we're kind of thrown into this extremely stressful environment. Now we know stress, isn't a great place to be long term, but no kidding, right? Uh, but why do some people respond the way they do, and then why do some people come back from it? And that's really what I really want to focus on today, so that you can be the person that comes back from it, because it's going to be inevitable that we face these crises, right? So let me show you a scenario. Okay, this individual um, is going through, was at the time of this test. Let's see if I can find it here. This individual at the time of the test, okay, was going through a divorce. Now, this is called an adrenal salivary index. And adrenal salivary index, a person takes these 4 vials. First one is between 6 and 8. The second one's between 11 and noon. The third one is between 4 and 5, and the last one is between 10 and midnight. And what they do is they collect their saliva, and then you send it to the lab, and they actually can run a test on it and measure the tissue levels of hormone. Now, this is important because blood levels are different than tissue levels. I'm not going to get into the nuances of salivary versus blood testing, but imagine getting blood tested for cortisol, stress hormone, and then being stabbed with a needle, and then try to understand how that could really influence the test in a way that isn't useful, right? So the cortisol testing, what I really love about this testing, and it gives us an idea of what the rhythm is, and then it gives us an idea of how things are progressing throughout the day, and it's an objective measurement. All right, so this top line represents the high end of what's normal, should be normal. This bottom line represents the bottom end of what should be normal. And then this solid line with these dots represents this patient's saliva collection throughout the day. Now you can see that their cortisol, which is a stress hormone that we release when we're stuck in stress response, is really high throughout most of the day. The morning, they're struggling here. They're actually okay, but you can see that the rhythm is a little flat here. So generally, a debutante practitioner might just look at the levels and go, oh, they're high, we got to get them down, or this is kind of okay, so we're just going to ignore these 2 points, point A to point B. But really, this rhythm isn't good. Their cortisol never really comes down. And so this could go on for a very long time. Okay. And this person probably has some short-term memory issues, right? They're setting their phone down, forgetting where it is. They're misplacing their keys. They may walk into a room and forget who they were going to call or text. They may just hear somebody's name, and then 5 minutes later or 30 seconds later, they have no idea what that person's name is. They might be really struggling to learn new information and retain it. This person may have the insomnia stuff that we talked about. If they have autoimmunity, their autoimmunity is certainly getting worse in this scenario. If they have um, any concussion in their history or whiplash injuries, they're probably loaded with other types of neuroinflammation symptoms like brain fog or dizziness, potentially vertigo, dizziness upon standing, etc. Like literally, we could just go on and on and on here. Okay. Now, this person is clearly in crisis, and this person is going through an acrimonious divorce, and there's no end in sight. Okay. The adrenal glands in this scenario are doing exactly what they're supposed to do. They're doing exactly what they're supposed to do. So, what do we do here? Okay. The longer these guys are elevated like this, the more significant the long term consequences to immunity, potential autoimmunity, autoinflammatory disease, um, digestive disturbance, acid reflux, leaky gut, food sensitivities, autoimmunity for food sensitivities. This can cause a person essentially to reconcuss their brain if they've been concussed by through like a series of chemical reconcussions. Okay, so what are we going to do here? All right, and this is what I'm talking about. If this person's in a prolonged scenario like this, then they may not come back out of this. And so the cool thing about this person is they have the adrenal resiliency to be adapted to their stress. What isn't cool is that this actually chews up a part of the brain called the hippocampus, and the hippocampus doesn't come back from that either. So the person can experience permanent brain damage from this type of cortisol profile. Okay. That doesn't mean that they can't recover function. It just means that we can't recover the neurons that are lost from this. And so this is what it might look like on an intake form. Okay, this is a section 8 of a form that a colleague of mine, Dr. Tatis Krasny, put together called the brain function assessment form. And it just allows me to quickly screen different systems and see how they're doing. And so this person has bloating after meals. Well, that's because they have high cortisol, and the cortisol is causing blood to come out of their stomach. And so they can't digest their food very well, which ends up becoming autoimmunity due to loss of oral tolerance. This person has dry eyes and mouth or dry mouth. This person's heart is racing, and this person's, right, they have this flutter in their chest because why? Because the energy crisis that happens when you have high cortisol and the increased sympathetic tone, if that affects the heart in a negative way, where all the mitochondria are in the body, then you're going to end up having a heart flutter if they're susceptible to that. So this is kind of what it looks like when there is high, what's called sympathetic tone or fight or flight. So a person can have high cortisol and they could be permanently stuck here. And so they're going to go try to get some Visine here. If they're bloating after meals, they might try some Tums, right? They may end up on Prilosec for that. They may end up on antibiotics due to like a yeast overgrowth for that. If they have a racing heart, gosh, they might go see a doctor and be put on some sort of like benzodiazepine to calm down panic attacks. I've even seen people that have high cortisol like this end up getting their vagus nerve, which controls the left side, accelerates the heart, and the right side controls rhythm. I've seen people get their vagus nerve cauterized or burned to try to even out their heart function when they really just had a hormonal, neuroendocrine, immune combination of things causing this heart flutter. So this is what that looks like. Maybe you know somebody that's really stressed that has heartburn. Maybe you know somebody that's really stressed that has dry eyes or dry mouth. They have a racing heart, which tells us a little bit about how it's affecting their brain and their heart. And they have a flutter, which tells us a little bit about how it's affecting different aspects of the nervous system that control their heart, right? Holy smokes. Okay. And so that's kind of a thing, right? So then if we look at another section of that form, we can go, well, what's cortisol going to do to their brain? Well, this is the medial temporal lobe. And so memory loss and impacts daily activities. Yep. Difficulty completing daily tasks. They just don't have the bandwidth anymore. Okay. Difficulty finding words when speaking. They go into like this, hesitation like that. They just can't find the words, or they might stutter or stammer when they're tired more than they normally would, or it's starting to happen all day. Disinterest in hobbies, social activities, or work. They just don't really care, because one of the things that cortisol does is it does a really good job suppressing serotonin. When serotonin is suppressed, we just don't enjoy the things that we normally enjoy. And so, when I see forms like this and there's a bunch of twos and threes, that's typically not a great thing, right? So this isn't even horrible, but there's just a lot of symptoms here. And the high cortisol is basically melting the temporal lobe. Now, in Alzheimer's disease, this is kind of like the first part of the brain that's going to be affected by that. And then it starts going to other areas. And then eventually it's so bad that they can't recognize faces and they don't know where they are. And so, but like these are early signs of memory issues that could become permanent. And there's more difficulty coming back when more neurons are lost. So that's just really something I want to emphasize. Now, if this person also has neuroinflammation, then they're going to have symptoms of brain fog, pain and inflammation, noticeable variations of mental speed. And then when their body's inflamed, they're going to have brain fatigue. So, like, like if they work out too hard and their knees hurting or whatever, and now they have brain fog with that. Okay. Or it's that time of the month and their hormones are dropping and, they're needing to take some sort of nonsteroidal like ibuprofen or Tylenol to help them recover from that pain. They're also having brain fog or brain fatigue at that time. Those are kind of examples of that. And so 90% of the brain are actually immune cells called glial cells. And those cells, when they're not doing their job, then the brain underneath it just doesn't work. So it's just another aspect of inflammation and high stress that can contribute to neurodegeneration that, again, is permanent and progressive. But don't get too discouraged here because I'm just talking about the consequences of this. I am going to talk about, some positive things about what a person can do and how to attempt and often successfully regain function. Okay. So that's coming later. Um, so now we look at how the stress could be affecting their just frontal lobe, not just specifically their hippocampus. So decrease in attention span, mental fatigue, difficulty learning new things, difficulty staying focused and concentrating, experiences fatigue when reading sooner in the past. A really good sign that a person's brain is undergoing significant neurodegeneration is suddenly they can't read. They just fall asleep when they read, and they weren't doing that before. Overall brain function impacts your daily life. This literally you can't function. You have to lay down and sleep. You're not able to maintain relationships because you're just so tired. So, this person is basically in trouble from this high cortisol, right? Now, there's an awesome book by Bruce Lipton, and he talks about what high cortisol does to the brain. And so, check that book out, Bruce Lipton, and it's a really amazing book. So, you can really start to understand how the physiology um, of high cortisol can affect the brain. And the name of his book is called The Biology of Belief. It's a pretty amazing book. So I highly recommend you check that out. Okay. So what are we going to do here? What are we going to do? And why is this actually happening before we get into what we're going to do? So here's what's happening. When we have high cortisol, sorry for all the clicking noises. All right. But let's say this is a cell. And then inside the cell, you have a nucleus. And inside the nucleus is DNA. Okay. Now you have a receptor for cortisol here. Okay. So cortisol comes in. It docks on this receptor, and then there's this kind of chain of events that causes the DNA to be aware of this. Okay. Now, one of the things cortisol does is anti-inflammatory. So, hey, didn't I say at the start of this video that you end up with inflammation in this scenario? And now I'm talking about how this is anti-inflammatory, right? So what the heck? What gives? So what ends up happening is we have all these receptors for cortisol. And so cortisol comes in and it stimulates these guys, and it starts stimulating the DNA. And the DNA, cortisol, remember, is stress hormone. The DNA is like, holy crap, we are stressed out. Okay. So you go into this cell survival response. Okay. And the net consequence of this over time is that, survival isn't necessarily rest and relax, digest and absorb. The net consequence of being a cell survival response, if it's prolonged, is the DNA is like, look, We got to make some serial changes because this isn't going away. But it also doesn't want to do that. Okay. It's like, you know what, guys, this, whatever we're doing here just isn't working. Okay. So we need to come up with a different strategy. So what ends up happening is you lose these cortisol receptors. And what happens is another consequence starts happening. So you start making something called NF kappa B. Sorry, I'm erasing the wrong thing here. So let me draw this guy again. So you end up making something called NF kappa B in the DNA. Now, NF kappa B is where that inflammation comes from. Now, cortisol can block inflammation over time, but when your cortisol is elevated for a long time, you start ignoring it, and it becomes a serious problem because this substance called NF kappa B starts going up. Now, NF kappa B is inflammation. And the problem with inflammation, and listen to me when I say this, it's so important, is this is permanent and it's progressive. It's permanent and progressive as far as this is a self-amplifying loop. Okay. So NF kappa B is just going to make inflammation go up. Okay. When inflammation goes up, you feel tired, you feel lack of stamina, and whatever system is the weak system is going to start having symptoms. So you might hurt somewhere. You might have your low back might hurt, your knee might hurt. You might get migraines. Okay. And so you're going to go get pain medicine. And if the anti-inflammatory pain medicine that's like a non-steroidal, like ibuprofen works, you're going to use that. And what it does is it kind of knocks down the inflammation. But this loop has a new set point. It has a new set point. Okay. What does that mean? Okay. That means that like in life, we kind of start out hopefully with like low inflammation down here. And then every time we have an inflammatory event, it just kicks up. And what we can do is we can calm down the inflammation floating around, but it gets harder and harder. And our overall level of inflammation just rises every year. It rises. This is why, like when we're kids, we can get pneumonia or we can get COVID-19 and survive. But when we get older and we're vulnerable, we get the flu, we get COVID, we get pneumonia, and we go into like this lethal range of inflammation. And the lethal range of inflammation, obviously, there's no coming back from. And so it's like, boom, people progress to lethal, and that's it. Okay. So as we get older, we just make more NF kappa B. And when we get the flu or we get that really bad job that's killing us, or we live in a house that's super moldy, or we got COVID-19, or we got a divorce, or we were fired from our job, or you just start going through life and you realize that it's really not even close to where you want it to be. You're worried about things politically, you're worried about things globally, and this cortisol, this idea that the world is chaotic, and you can't really figure it out, creates just an increase in sympathetic tone and cortisol, which drives this loop. And this NF kappa B loop just it ends up with a new set point every time. And so if you're down here and you get one of these major life crises, then you're going to feel like garbage. And then you're going to do some things like take anti-inflammatories, take Tums. You might go on an antidepressant. Okay. And you feel better. But then the next thing comes along and you get up here. Okay. And then you do the same thing that worked before. It doesn't work anymore. You need more of what used to work, or it just frankly doesn't work. So these are a lot of the people that present in my office is like they've tried things on their own and it just isn't working. They don't really understand why. They're just like, why did the stuff that I did before not work anymore? And it's because they've now gone to this next level of inflammation, and the stuff that worked at this level of inflammation no longer works. So this NF kappa B loop, the problem with it is you just don't go back to baseline. You go back to the next level above baseline. And doesn't that make sense? Doesn't that make sense? That's why all of a sudden you go through this extremely stressful event. Maybe you've gone through stressful events before, but you've always bounced back, and now you're not bouncing back. Okay. This person will need an intervention that addresses this NF kappa B loop for the rest of their life in order to keep their baseline. That's one of the biggest questions I get is, hey doc, how long am I going to have to take this supplement? Or how long am I going to have to make this lifestyle change in order to feel better? Because I feel amazing right now. And the answer is you might have to be on some level of support for the rest of your life so that you are not subject to bouncing into the next level that you can't come back from. Let me just take a quick aside of what one scenario of what this looks like. So let's say you know that you have a significant food sensitivity. Like every time you eat this particular food, you get a migraine, or every time you eat this particular food, you have like 3 days or 4 days of like diarrhea or constipation, but you always bounce back from it. It's like, okay, I'm going to eat this food because it's a special occasion. And then I bounce back every time. So I'm just going to avoid the food. I'm going to do my cleanse. I'm going to take my supplements. I'm going to get my rest, and I'm just going to come back from it. Then one day you go on vacation and you go fly somewhere. You didn't sleep because it was an early flight. You finally get there, and then you just do all of the things. You have all of the alcohol, or you have all of the cake, you have all of the chips, you have all of the pasta, you have all of the bread because it's like your anniversary. And then, sure enough, on your anniversary, you end up with a massive migraine on vacation. And then you come back and you do all the things to try to make it go away. And because you progress to this level, what worked at this level down here no longer works anymore. No longer works anymore. Okay. That's an issue, right? So now what? Now what are you going to do? Well, you might do more of what you did before. Okay. But at this point, this is when people really start presenting to my office because what's doing isn't working for them anymore. And so this is why I made this video, because I want you to understand that I don't want you to present to my office. So what can you do? Well, identify the things that elevate NF kappa B in your life. Okay. So if you know you have a food sensitivity and you always bounce back from it, just so you know, there may be a day when you don't bounce back from it anymore. And this self-amplifying loop is permanent and it's plastic. And at the very least, it's not going down. And it's kind of like this. A fire comes through and you can put the fire out. Okay. So imagine your body is completely inflamed. You take ibuprofen, it doesn't work. Then you have to go to like something like prednisone, and finally prednisone works. But then what happens when prednisone doesn't work? Right? Then it's like pain control medicine. Now you just basically are trying to tell your brain that you don't hurt, even though your body is completely being ravaged and burning down. So, okay, in that scenario, let's say we get the fire out. So you no longer express symptoms that were severe enough that required prednisone. The fire's out. So now let's imagine this is the California landscape. 4 months out of the year now, we have wildfires that just ravage the area. The trees are gone. Okay. The vegetation is gone. If your inflammation is down here, maybe it becomes like California in the spring, where you know what, it's water in the air, and there's water. We get rain in the winter, and the body recovers, and then you kind of go back and you can go through another cycle of inflammation, and then you get inflamed again, and then boom, okay, things burn down, but then they grow back. Okay, but at some point the NF kappa B gets so high that it doesn't come back, so you end up that hillside becomes a barren hillside, and the soil dies and it just becomes dirt, it becomes sand, and nothing can grow there anymore. Nothing can live there. And then basically when you get to the point where nothing can live there, that's death. That's kind of a morbid idea, but this is reality of what's happening. When we die, our systems finally fail because we become so inflamed it's untenable. That's basically what's happening. And whatever the weak link is becomes the link that goes out. So, okay, back to my story. What does this look like on labs? Okay, what does this look like on labs? Oh, this is relative future risk of cardiovascular event. So let me go back to what I was wanting to show you here. Um, Okay, here we go. Okay, so here's the deal. I included cholesterol in here because it's so funny. And it's not funny, but here's a scenario. This is what it looks like. This is acute inflammation. This is high CRP, C-reactive protein. So when you have high NF-kappa B because you're ignoring cortisol and your life has become so stressful that this self-amplifying loop is out of control, one consequence is something called an acute phase reactant called high CRP. I talk about this in a lot of my videos. Okay. The longer the CRP rages, the harder it is to come back from. Now you can see that it's not too bad out of range, but it's definitely out of range. Just a quick aside, this is cholesterol, LDL, right? This is the so-called bad cholesterol. The reason I call it so-called is because it does so many wonderful things in the body, like it's the precursor to hormones and the precursor to white blood cells, so you kind of need it. But this person was really concerned about their high LDL, which was like barely over range, okay? And they weren't as concerned that they had high C-reactive protein, because nobody really knows what this means. But here's what it means. C-reactive protein is that whole thing of relative risk of cardiovascular event. So that's the last thing that I just opened. So let me open that up again. So here's C-reactive protein. Relative risk for future cardiovascular event. Cardiovascular event is heart attack or stroke, or like a blood vessel just exploding. Okay, so when you see a high CRP, it's not something to joke about. Now, if you've had high inflammation and you're inflamed and you're like getting to be in your fifth and sixth and seventh decade, and your blood vessels are weaker because you've had chronic bouts of high inflammation, that's when it becomes a problem. So, like 1 out of 2 men in this country will die of a stroke. A person with high CRP, that's a male, that has a family history of stroke or heart attack, is really a kind of a ticking time bomb. That's just the reality. Okay. I have a family history of heart attacks and stroke. And so um, when you look at the average risk here, it says the average is 1 to 3, and this person had almost 6, almost double the range um, with high cortisol, right? They have high cortisol and they're ignoring their cortisol, and now they're have high cortisol and high inflammation, right? So here's the deal. The average is 1 to 3. Do you want to be average? Have you even done your CRP if you're a male? Okay. Do you want your CRP to be average? Meaning there's a 50-50 shot you have a stroke. Or do you want it to be below average as far as considering cardiovascular risk? And my vote would be below average risk, right? So I definitely want that for myself and my clients, unless it's appropriate to have a high CRP. And there are definitely times when it's appropriate to have high CRP, like when you have an acute infection, you're trying to upregulate inflammation to kill it. So, like if you have COVID-19, or if you have mono, or if you have strep, your CRP is going to be extremely high. And that's appropriate because that's a survival response your body's engaging to try to kill that infection. Okay. But you just don't want that prolonged. And you definitely don't want that prolonged affecting your blood vessels. And you definitely don't want that prolonged affecting your brain. And you definitely don't want that prolonged affecting your immune system. And we can see now that the longer that loop runs, the more likely the fire threat never returns back to normal. And it becomes basically extremely expensive medical expenses. It looks like at the end of your life, it can look like nursing homes because you're so inflamed that your brain doesn't even really work anymore. And so now you're in a nursing home. And of course, that's like close to 100K a year, depending on where you live. So there's really, besides quality of life advantages, there's advantages like, medical expenses and things like that. Okay. So hopefully I did a decent job explaining the self-amplifying loop and how significant it is. And that's the underlying physiology as to why, um, if it's you I'm talking to, or a friend of yours or a family member of yours, never really came back from their significant life event. Okay. Um, they were unsuccessful, or the people in their care team were unsuccessful in managing that. Now, let's go back to this idea here and say, well, what can we do in this moment to help this person circumvent all that? Because one more quick peek into what's going on with them here. That's so important. Here it is. So many screenshots, so little time. Okay, we know this person's stressed out of their mind. That's section 4 here. Always have projects, uh, things that need to get done, not getting enough sleep or rest, difficulty getting regular exercise, feeling that you're not accomplishing your life's purpose. Okay, we know that's going on. Okay, we've seen the hormonal consequence of that in high cortisol. We've seen the acute inflammatory consequence in high CRP when this is prolonged. And here's what it looks like. Cortisol does the opposite thing as insulin. So insulin decreases blood sugar and cortisol increases it. So craves sweet after meals, difficulty losing weight, increased frequency of urination, difficulty falling asleep, and increased appetite. Here's your basically person heading into prediabetes with this. No big deal, right? And so people will end up with type 2 diabetes and they're like, well, how did this happen? How did this happen? And this the stress response really just kind of drove them into that. Suddenly they're tired after they eat, they're getting acid reflux, and they never had this issue before. Suddenly they're gaining weight around the middle, they never had this issue before. And that's the underlying physiology that's going on. So if you're sitting here right now watching this video and you've been really stressed out during this shelter in place that's finally ending, and the world's starting to open up again, but you're 20 pounds heavier around the middle, you're noticing you're not sleeping as good, you're noticing you're not responding to exercise the same way, you're noticing that you don't enjoy life the same way, then this self-amplifying loop is definitely kicked on. And I'm hoping that this inspires you to have some conversation with the people in your care team to get this under control as quickly as possible. Okay, so the blood testing consequence of um, high blood sugar basically looks like I didn't make it. It didn't make the cut here. Okay, but basically it's you look like you have high hemoglobin A1C and you have high blood sugar, which is prediabetes. All right. Okay, so what are we going to do here? So hopefully you're not too scared because I'm not trying to scare you, but listen, I just want to level with you about what's actually happening because most people haven't heard this story and then they just feel like completely stuck and they start to feel despondent like there's nothing they can do. And I want you to know there's a way to navigate to a better place. There's also a way to circumvent the nastiness of this place because if you're in this situation and it's not looking good, okay, and you're just like your life is completely in chaos and there's really no way around it and you're stuck in this high ASI pattern, okay, first of all there's some things that you can do to help. Okay, now this is the same patient but in between um, tests this lab changed their how they present their report. Okay, but look at this now. So you can see how like this is all normal here. This is all normal. So there are things called adrenal adaptogens that you can do. And what they do is they kind of tell the brain to influence how they whip your adrenals to release cortisol. And so they've done these kind of barbaric studies on mice. They're called drowning mice studies, drowning mouse studies. And they throw these mice into water and then they drown them and they measure their cortisol. And then they took the same mice and they that are like genetically identical and they threw them into the bin after they gave them adaptogenic herbs and they measured their cortisol levels, and although they still drowned and they died, their cortisol levels weren't through the roof when they took these herbs. So listen, remember how cortisol caused that self-amplifying loop, and the longer the cortisol is high the worse that loop is going to be, and the worse your inflammation the harder it is to come back from it, and the closer you are to a significant setback in your quality of life. So at the very least, adaptogenic herbs can be super, super, super helpful. Those are things like holy basil, ginseng, ashwagandha. I'm not saying go out and take those. I'm saying you might want to consider those things Some people don't do well on those at all for other reasons. They have sensitivities to some of the ingredients. They have autoimmunity, and so they don't respond to them. They actually require activation in the liver, and they have liver issues. So they take the herb and the liver doesn't work to activate it, or they have a gut issue and they take it and it doesn't work because the gut doesn't actually convert the herb to its useful form. So some of you have heard of adaptogenic herbs and you're like, hey man, I took those and it did nothing for me, and I have the labs to prove it. Well, that person probably has such high inflammation, their liver isn't converting those herbs, or they have a dysbiosis and they're not converting those herbs, or they had a malabsorption and they didn't take it in a form that actually worked for them. So there's a reason that those herbs didn't work, and getting to the underlying reason those herbs didn't work could be the mechanism that completely opens up their quality of life and prevents this completely devastating self-amplifying loop from taking hold. It's not time to say that sucked. It didn't work. I'm giving up. It's time to say, let's explore this and figure out why that is, which sometimes it takes some time to figure that out. Okay. So at the very least, you might want to consider that. Now, listen, what if you're that person that I talked about that doesn't respond to adaptogenic herbs? What if you're that person? Well, what do you do? Okay, what do you do to prevent that degeneration or melting away of the hippocampus? What do I do to prevent this self-amplifying loop from kicking in? Okay, what do I do if I'm stuck in this cortisol pattern that we talked about at the start of this video and we can't get it to come down? Okay, well, look, there's something called phosphatidylserine. Phosphatidylserine blunts the effect of cortisol. So if you can't get cortisol to come down, there are certainly cases where I might recommend that they take a cream called adrenal from Apex Energetics, which is pretty cool, and it blunts the effect of this cortisol. So even if cortisol is elevated, some of the negative consequences at the cellular level that we described and some of the negative consequences at the hippocampus that we described are better. Okay, meaning they're not as significant. And so that would look like the person, they put the cream on and wow, they fell asleep that night, or they only woke up one time, or they don't have acid reflux anymore when they eat, or they put the cream on and they no longer have brain fog. Okay, or their hands and feet aren't freezing cold anymore because their sympathetic nervous system calmed down. So that cream is something that I often prescribe. Sometimes people do better on an oral version of that, although it doesn't absorb very well. Okay, so that's something that might work to blunt the impact of cortisol at the very least. And like, here's the deal: like, if you're this person, you might actually feel like you're on top of things. They may not have a lot of symptoms yet because if this is really early and they just haven't had a bunch of inflammation and cortisol in their life, they may feel on top of stuff here. They may feel on top of stuff here, and it doesn't show up until that next crisis in their life or the third crisis in their life where they don't come back anymore. Okay. But if they manage this crisis effectively, that second and third crisis don't become untenable. Does that make sense? That's what I'm trying to show you, that this is possible. Okay. See if there's anything else I wanted to share with you about this. Back to this here. Okay, these situations can be transient, but a person can get locked into this. This is just the brain going south here. And so if you have these symptoms, don't wait to intervene. Get after this the best way that you can. And what does that look like? Okay. So if you have this self-amplifying loop happening, we need to identify lifestyle factors first and foremost, other than the extremely stressful crisis that you're going through, that you can actually modify. Okay. So one of the biggest ones is people just don't move enough. And inactivity or sedentary lifestyle, it actually elevates this inflammatory profile. Just doing nothing, doing nothing elevates this profile. And it does so by the brain requires movement in order to work. And so when the brain doesn't get the movement it needs, then it loses function, and then it can't really gate. It ends up, the consequence ends up being high stress. high sympathetic tone and high cortisol, insulin resistance, weight gain, if your genetics do that, or weight loss if your genetics do it that way. But the core message is this self-amplifying loop just comes up and you can't calm it down over time. So sedentary lifestyle is probably one of the biggest things that I see. And of course, like many of you, um, I kind of got caught in this loop of inflammation this last year because instead of like standing and working with patients and like, doing all the stuff that I do in my clinic, um, I spent way more time in front of a computer on Zoom. And so even though like I was essentially exercising the same and essentially eating the same, I wasn't moving as much. And then I found that my labs showed that I was getting more inflamed and that I just felt not as good too. Okay. Started getting more aches and pains, things that normally don't plague me started happening. Of course, it's different for me than it's different for you. But the idea is I was spending a significantly higher amount, maybe up to 5 or 6 hours more a day, just sitting in front of a computer screen that normally I don't. And that sedentary activity really impacted me. So, what's a good thing that I might want to consider in that situation? Well, I might want to consider some adaptogenic herbs. I might want to consider offsetting that by doing a different exercise routine that includes like getting up and moving in between sessions when possible. And I might want to consider something like adrenal if my cortisol was high to blunt the effect of cortisol until life becomes normal again. And then there are different herbs that actually lower NF-kappa B, like turmeric is a spice that can do that. Resveratrol is a substance that can do that. There's just a lot of things that actually lower NF-kappa B. So I'm going to hit stop share here in a second. Another lifestyle factor that most people haven't really considered or maybe stuck with is that there is absolutely an impact in the food that you eat. Not only what you eat, but how you eat it. So do you fry it or do you slow cook it? Do you cook it on aluminum or do you cook it on, a type of metal that doesn't leach into the food? Are you sitting around the stove all day and it's a non-electric stove, but it's a gas stove? It's not ventilated well, and so you're getting all these toxins. Are you living in a house during shelter in place or working from home more now, not moving as much, but you also have a house that maybe is moldy, or there's something going on? Maybe you got all this new furniture, new carpet, you decided to paint, do all these decorations, and now you're just like living in this kind of nightmare of chemicals that off gas, and that's influencing you. The amount of alcohol that people consume typically, from what I've seen, has gone up quite a bit during the shelter in place. So alcohol definitely does not positively influence this loop. The amount of starches that a person consumes, if they're in excess for what their body wants, definitely influences this loop. The amount of sleep that you get definitely influences this loop. The quality of your relationships, uh, being at least staying in touch with people and feeling connected to people and not being isolated, absolutely influences this loop. So there is a lot that you can do to influence this NF-kappa B profile from a lifestyle perspective, so it's not continually rising. You feel like maybe you don't even notice it, but you're like the frog in boiling water until that crisis happens, and then you just don't come back from it. There's a lot of things that you can do once you're in that crisis with herbs, medications to kind of calm that acute inflammation down. But there's no guarantee that when the acute phase is over, that you just go back to the way you were. So hopefully, I did a good job emphasizing that point. And hopefully now, I know these are kind of longer videos, but the idea is like you can't really summarize this in a way that makes sense uh, by going shallow. Like I wanted to include some depth of what this actually looks like on an intake form, what a history might sound like, specifically addressing some of the topics on the forms as to what a person might do um, to try to manage these. Like we talked about Visine or like Tums or something like that to help their acid reflux. We talked about lifestyle factors that influence this that maybe you kind of knew about, but haven't really gotten out of the picture yet, like too many carbs, too much alcohol, not enough sleep, poor relationships, living in a toxic environment from mold or from um, chemicals. And we talked about ways to blunt the effect of cortisol with particular supplements or ways to modulate brain function so that cortisol isn't elevated. And so we covered a lot of ground today. If you like this video and you want to see more, just leave a comment and like our channel and get the little notifications. I try to make these videos not as sporadic, but it's takes some time to put these long form videos together. So I hope you enjoyed it, and I look forward to catching you the next time. Have a great day. Bye.